The standard anatomical position is the universal reference point for all anatomical descriptions. It involves the body standing completely erect and facing directly forward. The feet are placed parallel and flat on the floor. The arms hang at the sides with the palms facing forward. The thumbs are pointed away from the body. The head and eyes are directed straight ahead. It is crucial to understand that all anatomical descriptions are constant and refer back to this position, regardless of the patient's actual posture during an examination or procedure. We will now define the core pairs of positional and directional terms. Superior, also called cranial or rostral, means toward the head or the upper part of a structure. Inferior, also called caudal, means away from the head or toward the lower part. Anterior, synonymous with ventral, means toward the front of the body. Posterior, synonymous with dorsal, means toward the back of the body. Medial means toward the midline of the body. Lateral means away from the midline of the body. Intermediate describes a position between a more medial and a more lateral structure. Proximal means closer to the point of attachment or origin of a limb to the trunk. Distal means farther from the point of attachment or origin of a limb. Superficial, or external, means toward or at the body surface. Deep, or internal, means away from the body surface and therefore more internal. Next are special positional terms. Ipsilateral means on the same side of the body. Contralateral means on the opposite side of the body. Unilateral pertains to one side of the body. Bilateral pertains to both sides of the body. We now move to anatomical planes, which are a fundamental concept. Anatomical planes are imaginary flat surfaces that are used to cut through the body or an organ. These planes are used to visualize internal structures and describe sections of the body. They are absolutely essential for interpreting medical imaging like computed, tomography, and magnetic resonance imaging scans, and for describing surgical approaches. The first major plane is the sagittal plane. This is a vertical plane that divides the body into right and left parts. The mid-sagittal plane, also called the median plane, lies exactly in the body's midline, creating equal right and left halves. A parasagittal plane is also vertical and parallel to the mid-sagittal plane, but is offset from the midline, creating unequal right and left sections. The second major plane is the frontal plane, also known as the coronal plane. This is a vertical plane that divides the body into anterior, or front, and posterior, or back, parts. It runs perpendicular to the sagittal plane. The third major plane is the transverse plane, also called the horizontal or axial plane. This is a horizontal plane that divides the body into superior, or upper, and inferior, or lower parts. It runs perpendicular to both the sagittal and frontal planes. The transverse plane is the most common plane used for computed tomography scans. Additionally, there are oblique planes. These are cuts made at any angle other than a right angle to the three standard planes. Oblique planes are used in specialized imaging and for certain surgical approaches. Directional terms can be combined for greater descriptive precision. Examples include posterolateral, meaning posterior and lateral, anteromedial, meaning anterior and medial, and inferolateral, meaning inferior and lateral. Now we begin the section on movements, starting with fundamental concepts. Movement terms describe changes in the position of body parts at the joints where they meet. All movements are always referenced from the standard anatomical position. Most movements occur in pairs, with each term in the pair describing the opposite action. The first pair of movements is flexion and extension. Flexion is a movement that decreases the angle between two body parts, such as bending the elbow. Extension is a movement that increases the angle between two body parts, such as straightening the knee. Hyperextension refers to extension that goes beyond the normal anatomical position, like looking upward by tilting the head back. The second pair is abduction and adduction. Abduction is the movement of a limb away from the midline of the body, like raising an arm out to the side. Adduction is the movement of a limb toward the midline of the body, like bringing the arm back down to the side. For the digits, meaning the fingers and toes, abduction and adduction are defined relative to the midline of the hand or the midline of the foot, respectively. The next movement is rotation. Medial rotation, also called internal rotation, occurs when the anterior surface of a limb rotates toward the midline of the body. Lateral rotation, also called external rotation, occurs when the anterior surface of a limb rotates away from the midline of the body. There are special movements of the forearm and hand. Pronation is the rotating movement of the forearm so that the palm faces posteriorly, or downward when in the anatomical position. Supination is the rotating movement of the forearm so that the palm faces anteriorly, or upward when in the anatomical position. Opposition is the special movement of the thumb to touch the tips of the other fingers on the same hand, a motion essential for grasping. There are also special movements of the foot. Dorsiflexion is the movement of lifting the dorsum, or top, of the foot upward toward the shin. Plantar flexion is the movement of pointing the toes downward, away from the shin. Inversion is the turning movement of the sole of the foot medially, or inward. Eversion is the turning movement of the sole of the foot laterally, or outward. Other important movements include circumduction. This is a circular, conic motion that sequentially combines flexion, extension, abduction, and adduction, as when moving the arm in a wide circle. Elevation is the movement of lifting a body part superiorly, like shrugging the shoulders. Depression is the movement of moving a body part inferiorly, like lowering the shoulders. Protraction is the anterior movement of a body part in the transverse plane, like jutting the jaw forward. Retraction is the posterior movement of a body part in the transverse plane, like pulling the shoulders back. The body is divided into two major regions. The axial region forms the main axis of the body and includes the head, the neck, and the trunk, which consists of the thorax, the abdomen, and the pelvis. The appendicular region consists of the appendages or limbs that are attached to the axis. This includes the upper limbs and the lower limbs, along with the pectoral girdle, which is the shoulder, and the pelvic girdle, which is the hip. Finally, understanding anatomical terminology has direct clinical and practical application. In radiology, it allows for the precise location and description of findings on X-rays, computed, tomography scans, and magnetic resonance imaging scans. In surgery, it is critical for planning incisions, describing operative approaches, and accurately documenting surgical findings. During physical examination, it ensures the accurate documentation of the location of masses, areas of tenderness, or wounds. Most importantly, it provides the foundation for unambiguous and precise communication between all healthcare professionals, from physicians and surgeons to nurses and therapists, ensuring patient safety and effective care. Thank you for watching. Don't forget to like, share, and subscribe. See you in the next one.